2 days after the commemoration of the Armenian genocide, which took place in 1915 to 1918, which we commemorated this weekend. April 24th is traditionally when Armenians worldwide remember the murder of 1.5 million Armenians by the Ottoman Turkish Empire. Of course, we've moved past that now. I actually have hired, my IT guy is Turkish. We get along great, so it's time to move along, but at the same time, there's one day a year we commemorate it, so. All right, our patient today is having a bilateral Deuk laser disc repair. We said left 3-4, right 4-5. That's not my stomach grumbling. That is our patient happily snoring. Let's see how long we can keep it that way. Yep, and it ends. It's Dr. Deuk Majin. We're just giving you some numbing medicine. You're okay. Have you ever heard of a buzzkill? I'm the dream kill. Hey, you're fine. It's just some local. Yeah, everything's okay. So we wanted to numb things up a little because we're going to make an incision in just a few minutes. Did you get some good sleep? All right, we're going to get started. Everybody agree left? This is the left side, Luis? Yes, sir. This is 3-4. You agree? I agree, sir. All right. 3-4 is the worst of the discs. We were looking earlier at the x-ray because the x-ray is what we use during surgery to navigate, and our patient has a really nice x-ray. I would drop the table just half an inch. Good. That should be all right. Let's see where we are. All right, that's pretty good. So our patient has a nice curvature to the spine. Everything looks good. The only problem is that he's got two discs that are pretty badly herniated. Shot? Gosh, perfect. He's happily snoring. And we were just talking in the pre-op area, and he was telling me that he actually feels better and was actually thinking about holding off. But the problem is, honestly, he's got weakness in his leg, Shot. And that weakness is from the nerves getting pinched pretty badly. That weakness will never go away on its own. And that weakness is the reason we're doing the surgery today. So, to overcome the weakness and unpinch the nerve. Shot. Now when someone has a pinched nerve and weakness in their leg or arm, Shot, then you really do need to do surgery. It's okay to wait when they have pain, but it's not okay to wait when they have nerve damage. And this patient has nerve damage, so that's why we decided to collectively, he and I both decided in the pre-op, yeah, you might be feeling better, but we need to get this fixed. Shot? All right, I'm up against the facet joint. I'm going to need to get around it. And there we are. We're around it. Let's get an AP. So if you're looking at the x-ray, there's a needle coming in, and that is the number 3-4. Everyone agree? 5, 4, 3, 3, 4. You can see there's a herniation right at the tip of that needle. Perfect. And it's a perfect positioning on the AP. He's got just the slightest amount of scoliosis, maybe 5 degrees at most. The scoliosis isn't the cause of his problem. The problem is he's got a disc osteophyte on the left side. We all agree, left side 3-4, right side 4-5. So we'll be getting to 4-5 shortly. Was there a question? You guys, any questions from the audience?
No questions currently, doctor.
All right. I can't tell you any other details about our patient, but I can tell you he's a physician, and has watched me perform these surgeries and honestly did not want to have open back surgery. Do you blame him? I don't blame him. He's seen many open back surgeries himself and decided against it. Shot? May have to start a little higher up here. Shot? So remember, we're doing the 4-5 on the right. We all agree this is the right side, it's 4-5. I like to ask many times during surgery just to make sure. It's better to be safe than sorry. That's something that an adage I've grown up with. Better to ask, you know, my wife always says to me when I'm driving with her, why are you always asking directions? I say, well, I mean, yes, I know where I'm going, but it's always good just to verify the answer. That's it. He's got a bit of arthritis here at the facet joints, but not too much. Shot? He is so happily sleeping. I'm impressed. I have to admit, I'm a little jealous. I've got teenagers, and my teenagers keep me up at night. At least at this stage in their life. I don't get sleep that good. AP, maybe I need to visit your operating room one of these days. You can give me about 12 hours of sleep like that. Right? Yeah, yeah, yeah. You're right. All right. Let's go back to a lateral. So we're well away from the nerve root, way below it, the exiting root, and we're lateral to the traversing root. So let's just see if we're close enough to where we need to be. The patient and I were talking in pre-op, and he knows we have to do a discogram. No, it's all right. His problem isn't back pain. His problem is his legs. So I told him I wouldn't do a very aggressive discogram because back pain isn't the biggest issue for him. I still have to do one. He knows that. Shot? Shot? Okay, so you can actually see the tear in the back of the disc. That's at 3-4. Yeah, we only needed one. That was 3-4, folks. Now we're going to do L4-5. Shot? Yeah, you can see the leak into the shot into the epidural space. So, of note in this particular patient, this patient has short pedicles. So I don't know if I talked to him about it, but he's got what's called congenital stenosis. Congenital stenosis means you're born with narrowing or stenosis. And the reason he's born with narrowing or stenosis is because he's got short pedicles. Look at the pedicles higher up. Jordan, will you show our audience the pedicle up there at 5-4-3-2? Look at the pedicle at 2. Now, because the pedicle at 2 and 3 are more normal, show them the foramen. Look at how wide that foramen is. No, yeah, there you go. Big. Bigger. That whole white area. No, go back up. That whole foramen there. Yeah, look how big it is. That's the room for the nerve root to come out. But now look down lower, because the pedicle of the one below, which is number 4, right up there, the pedicle 4, yes, that is short. That means the foramen at 3-4 is narrow, and the foramen at 4-5 is narrow. So it doesn't take a big herniation to get nerve damage, because the foramen is already too small. So the house of the nerve, where the nerve lives and exits, is not big enough. And then once you start getting bone spurs and herniations in there, those guys are far more hard than the nerve. The nerve is soft like tofu, so it's going to get crushed in that small space. All right. So his big problem is symptomatic stenosis of the spine, or spinal stenosis, specifically of the lateral recess and the neural foramen. So he has what we call foraminal stenosis or foraminal narrowing. And as a result, he has nerve damage. And we're going to go in there and unpinch those nerves. All right, you're fine. Yeah, he doesn't like that. But we're right on the herniation right now. Luis, everything all right? You ready, doctor? Want me to wait? Yeah, once you start touching the back of that disc that's painful and inflamed. Any questions from our audience so far?
No current questions, doctor.
All right, let's go ahead and show our audience why herniated discs can cause back pain and why they can cause leg pain.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, we're inside the disc at L3-4. We're just removing the dilator shot, and you can see the tube is there. So we're going to do the L3-4 left side approach first. You're good now. I mean, you should be more comfortable because we're not messing with the annulus right now. So we just showed you a video animation on how herniated disc annular tears can be so painful. Whoa, what's this? Why is it dripping through? That's weird. Like went around the bag or something. All right.
Thank you.
Okay, we're inside the disc. You can see the blue stain is the degenerated nucleus pulposus associated with the herniation. You can see the end plates to the side there. We're going to start taking out. Can you move that light a little? Are you okay?
Doctor, can you move this away, please? Sorry. Thank
Just
you.
a little bit. This is the first herniation. That's fine. I can see better. Yeah, I'm fine.
This light, please. Yeah, please. Thank you.
Unless you need the light, doctor.
No, I'm fine. I just didn't have a good view of the pond.
This is a herniation right here. Oh yeah, it's a big one. Oh, that's a giant. Let's get this picture. This.
Lights on, the roof is fine, the roof. The roof.
So you think it's the local we're using? You guys see this? Or you want us to use the blue towel? Can you see it better over the blue towel?
I think this
Yes, the blue towel is better.
light affect the view.
All right. So
Scope
look at the herniation here that we just pulled out. You see it?
stand by light there.
Yes, we do, doctor.
All right.
Thank you. Scope on, please. Thank you. Thank you.
Yep.
Lights off, please. Thank you very much.
There'll be a few more fragments that we'll pull out, but that was a good sized chunk. I wonder if I can get that right there. Is he okay? Another big piece, almost the same size. We're not going to highlight it though, we've already seen it. But he's definitely has a couple of big herniations here. And some smaller ones. Gentlemen, why don't we show our audience how the Deuk laser disc repair works.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Hey, can I ask you? You guys were not on air, right?
We just went back, doctor.
You just went back on?
Yes, sir.
All right, yeah, always give me a countdown, guys. I need to know when I go back on air. Just say on 3, 2, 1. That way I can plan it. All right. So we're still at L3-4, which is left side herniation and impacting the nerve root on the left. And I found several large herniations, and we've removed them with the grabbers and the laser. And I think I found yet another right here. This thing's huge. Look at that thing. That's a biggie. That's another biggie. So I've taken out now 4 really good size herniations. And that was lateral in the disc. So really it would have been what's called a foraminal herniation. Look at that. A lot of inflammatory tissue from that herniation. So why do people with a herniated disc get better on their own and then get worse again later on? The answer is that they heal up from that first herniation. Then and when I say heal up, their inflammation goes away and gets under control. But then they re-injure the same disc and they get more inflammation with more herniation. And it's kind of a vicious cycle. The reason is because the tear in the annulus that allowed the herniation is still there. And until the tear is repaired, which is what we're doing right now with the Deuk laser disc repair, that tear is prone to having more herniations. It doesn't take much force to get more herniations. That's interesting, isn't it? That pattern. Berndes, that pattern. Yeah, a pattern. Is everything all right? Don't mention that's a dirty word. We don't mention that word in this.
He just has a little sleep back. He's just obstructing a little bit as he's inspiring.
I see.
He's moving air, but it's just
Yeah. No, everything is good here. So I'm happy with his level of sedation. Just about done with this particular disc. It's beautiful.
But he might be like this at the house though.
Yeah. Yeah. Makes for an entertaining evening. I almost,
One's watching Netflix, the other one's on the couch like this.
right? I can tell you this. Some people like to hunt and they have to do calls. Some people don't have to do the calls.
Sorry, some people like to what?
You don't have to do the call. Call is done. Woo, my feet are getting cold. Just about done. Looking good. All right, let's run a video on one of our patients who had the procedure done, so our audience can see what kind of results can be achieved. We're pretty much done here. I don't see any more herniation.
All right, lights on, please.
Wait. The nerve is right up here. Let me just see that right there. I want to get that. A little bit of lateral disc. Yeah. Everything all right? Grab her.
Sarah, you should have that too, on the bottom. No, the nurse's cards. Yeah, she should be there.
surgery to fix these patients' issues, which is far more invasive.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, A spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
All right, good. Dr. Deuk, we're back with you. We have now, when are we demoing that new fluoro?
Not quite sure. I have to ask Mom.
Yeah, I've been waiting for them. All right. Huh?
I think she's trying to get contact with Mom.
Okay.
But I'll get you.
So for those of you who have been with us since the beginning, we started on the left side, and now we're on the right side. We're doing a different disc on this side. This is the L4-5 disc.
And then Sarah, yes. Yes. Yeah. No.
And the reason is because the herniation on the left side was at L3-4 hitting on the nerve, and on the right side it was at L4-5 hitting on the nerve. You can see the herniation right here. Pretty messy. That's good, guys. Yeah, I'm fine with that. There's a tear here in the annulus, and I'm just going to be trying to remove this herniation and debride the annular tear so that this disc will heal properly and not give this patient any more problems. All right, any questions from the audience?
No current questions, Doc.
It's pretty bad. I don't know if you guys can appreciate, but that's a lot of scar tissue in there, and it doesn't look that old. It looks like it's about 2 years old to me. Very consistent with an injury of the disc, at least at this point. That's a couple of years old. This doesn't look like a 10-year-old injury. All right. Now we're getting the laser in action. You can see how the laser just attacks the herniations and breaks it up. they're stuck in there inside the annular tear. The annular tear is holding onto them, doesn't want to release them, but the laser forces that release. That way we can clean up the tear and it's going to be able to heal. Having trouble with the wire? It's pulling on my finger. If you can bring it. No. What do you normally do? Yeah, that's better there. Yeah. It's a little different than the last disc, right? Different appearance, different texture, different age of injury. This is the big fiber, right?
Yes, I recall the exact time this happened.
You recall the exact time this happened?
They told me.
Yeah, okay. When was it?
He said it was about a year ago, roughly.
About a year ago.
Over quickly while doing laundry.
Yep.
He said that the pain was so intense, it made him physically ill. He said.
Yeah. Well, there's a piece of herniation right there. And he's got a lot of them. So this, I can promise you, didn't happen in one sitting. This disc here looks like it's about a year to 2 years old, as I said earlier.
Right, that's what he said.
Yeah. But I can tell there's multiple herniations. So that means that he injured it multiple times.
But
And
maybe
that's
the last one was the most severe. of them.
exactly right.
He said that
Yep.
he never felt sick before he told me.
Yeah. Well, it's kind of like every time you re-herniate, you put another marble in the marble bag, right? And the marble bag, you know, marbles don't just go away. They stay there. And the bag gets bigger and heavier over time. So
John?
it's, huh?
John from YouTube asked a question.
All right, we'll get to that. But as the marble bag gets with more and more herniated fragments, like more and more marbles, it's just the bag is going to get bigger and do more damage. You know what I mean? It's cumulative. All right, can you turn your volume up a smidge?
Of course. Okay. John asked,
A little bit more volume. I can barely hear you.
how's this?
That's better.
Awesome. Yeah, John from YouTube asked, how bad of a herniation does one need for such a surgery?
Well, I just couldn't hear you, my friend. You were nice and loud at the beginning, and then it died off. Try again.
Okay, here we go. How bad of a herniation does one need for such a surgery?
How bad of a herniation does one need for such a surgery? That is a great question, John. You need a herniation that causes pain or pressure on your nerve to the point that you're getting weakness, numbness, or pain down your leg. So basically a herniation big enough to cause symptoms. There is no size restriction. We don't operate on people's disc herniations because they reach a certain size threshold. We operate on a herniation because it's causing pain for the patient, and they don't want to live in pain anymore. So if you're that person that has pain in your back or your neck or your thoracic area from a herniated disc, it doesn't matter how big it is. I can tell you this, the small herniations typically are the most painful. It's like a rattlesnake, you know, baby rattlesnakes have the most poison. Their venom is more potent than an adult rattlesnake. So, you know, you don't want to get bitten by a baby rattlesnake. Just like you don't want a small disc bulge. A small disc herniation or disc bulge can be very, very, very painful. Those are the ones that need surgery. So it doesn't matter how big it is, you just need to have symptoms from it. And that warrants the need for this surgery. I hope that makes sense. It's a great question and a very important point for us to make. Great talking point. All right, once again, we are on disc number 2 out of 2 for this patient, and we'll be done in 5 minutes. Our patient is snoozing comfortably, very happy. I'm amazed. Look at the difference of what this disc herniation looks like compared to the one we just did. far more full of water, full of volume, more voluminous, not as like old and scarred up. It looks more recent, like about a year to 2 years old, as I was saying earlier. But again, multiple pieces. And all this stuff is scar tissue here, internally within the disc. There's a name for this called internal disc disruption, IDD. And that term has been around for a long time. And what it means is the inside of the disc is severely damaged. And that's exactly what we're dealing with at L4-5. The inside of this disc is severely damaged. All right. Getting close to getting towards the periphery. Look at all these fragments here. This is a huge blowout. Every one of these pieces you're seeing is another herniation. Every single one. There's probably 30 pieces at least that I've seen so far. And they're all loosely held together. Very damaged, very damaged disc. How's my irrigation? Good? I don't know. I mean, you tell me if it's near empty. Yeah. This is the time to do that. I can just see it drying up. Laser. Yep, we saw the rush of air bubbles. Oh, still a lot of loose pieces down here I'm going to have to come back and get. Man. I don't know if for those of you that can appreciate this, that watch a lot of my surgeries, this is just a really messed up disc. And for sure, you know, we were talking about this before surgery. He was wondering, what's the likelihood my symptoms will come back? I would say now that I've been inside this disc, 100%. 100% likelihood that his pain will get worse over time. This is not going to heal itself. Big herniation right there. Man, that thing's huge. Can you see, Luis? Can you see? Yeah.
We have another question.
Sure.
Why do muscle spasms on the lower back cause unbearable pain?
Yeah, muscle spasms actually usually don't cause unbearable pain. It's not muscles that are causing the pain. It's usually facet joints or disc herniation. The problem is that doctors are always misdiagnosing that pain as muscle spasms when it's not. So muscle spasms can be extremely painful. You are correct. I'm just saying, chances are if someone's diagnosed you with muscle spasms, there's an underlying condition underneath it, causing all that pain. In other words, people don't just get muscle spasms. There's a few exceptions, you know, like cervical dystonia, torticollis, which is rare, but it's something to do with the basal ganglion and the brain, and it causes the neck muscles to tighten up all the time. But other than that, people do get muscle spasms, but it usually is after surgery on the spine where the muscles are manipulated, and it's usually just for a few days to a few weeks. Other than that, the pain is not from a muscle spasm. It's from either the disc herniation or facet joints. Now, the disc herniation can act up and cause horrible pain in your back, and then that can cause your muscles to tighten up. So that does happen. But they're secondary. The muscle spasms are secondary to facet pain or to disc pain. So get rid of the primary cause of pain, and you get rid of the muscle spasms permanently. So I'm not sure if you've had your MRI sent in yet for us to look at, but go ahead and type in the address for the free MRI review. Would you do that? That's mri.deukspine.com.
On it.
Send us your MRI, we'll look at it and see what's causing your pain. Just about done, maybe 5 minutes, doctor. Just a lot worse than I thought it would be, so it's taking me longer than I thought. But yeah, he's starting to feel this. Yeah, we're done after this. Last level. You can see he stopped snoring. You doing all right?
Yeah. All this snoring,
Right, it's contagious.
it's transference,
Mm-hmm.
right?
Yep. Not really, but transference is a little different.
I'd be like, he was really anxious, and I became anxious. That's the
Yeah, I mean, transference is when people transfer their blame for things onto someone else. It's a psychological term, a phenomena. Projection is another one. There's some difference between projection and transference. Honestly, I can't remember the difference, but huh? Just about done. There's one end plate, there's the other. Still a little bit of herniation here, right up against the nerve. That would be the traversing root. Just about. Look at all the debris though, huh? Flying in the air. Looks like a tornado. Oh God, yeah. This whole L4-5 disc was annihilated. It was blown. It was like a C4 went off inside the middle of it.
What do you think the average adult has as far as herniations? Say at age 50, by the time they get to 50.
Symptomatic or asymptomatic?
Asymptomatic.
Asymptomatic, they did a study in Japan. It showed 90% of people over 45 had herniated discs. At least one. But they were asymptomatic. Well, I should say 94% of 900 out of 1,000 people that were asymptomatic, no pain, no symptoms, nothing, had herniated discs.
Okay.
900 out of 1,000, so 90%. Yeah, they just grabbed 1,000 people off the street with no pain, no symptoms in their neck or back, and they scanned them with an MRI and found herniated discs in 900 out of 1,000. They had no symptoms whatsoever. So it's very common to have herniated discs without symptoms. That's why I don't operate on all the herniated discs. I have to make sure that it correlates with the patient's symptoms. Gosh, that's a big herniation there.
So I worked with a surgeon who, at 19 years old, when he was in college,
Yeah.
herniated his disc to the point where he had bowel and bladder problems.
Ooh.
Really bad. And about a month later, it kind of just subsided, and he was able to walk better and get around and go back to college. He was a freshman.
Uh-huh.
He's now a plastic surgeon. He said that it never really came back. He said he was so felt so blessed that it never really bothered him. And he's a very athletic guy. He plays semi-pro soccer, very athletic, and he's always in the gym working out. And I never once in the 6 years I've worked with him ever say a word about his back. And he works long hours.
Really?
Long hours. Like we start at 7:30, we're out like 7 a.m. We start at 7:30, we're out at 9.
You hear that, ladies? Don't complain about me.
Yeah. He works hard. Bums we lose a lot of staff sometimes.
Really? I won't keep you guys till 9.
I think once you get back, we're going to more regularly. I'm sure it'll be fine.
Well, what I would like to do is, of course, keep our days reasonable. But if we ever get to the point where we need to, we'll just do shifts. You know? We'll have a day shift and an evening shift.
I'm professional. Whatever time you need here, I'm here.
I appreciate that.
I don't care.
Well, honestly, I think the best thing to do is to have a second anesthesiologist just on the days that we're going to run 2 rooms, and basically have the anesthesiologist run the second room. That's a big herniation right there. It's kind of wedged in. You all see that? Just got to get a little more. Debulk it.
Fortunate that I live so close.
Huh?
If I'm tired, I'm driving home late. It's an easy drive.
Yeah.
I could walk it.
Can drive you home. Could put you in a wheelchair and
I
just...
live right on Vera Boulevard and you're up.
I know. That's what I call dedication. This is the internal disc disruption.
Oh yeah.
Just about done. This is the outside of the annulus right here. If I can just make sure we got it all. There's a piece. You see that? It just popped out. Not a big one, but it's everything counts in large amounts. We need about 2 minutes and we'll be done. Doctor? Unless something else big pops out.
Yeah, I'm running a really low dose.
Good. So basically, what does that mean?
So low dose is about 20 micrograms per kilogram. That's considered low infusion. When you're above 50, that's your moderate, and then 100 or higher, that's
My question is, when do you see that?
high dose. What's that?
When do you see that?
Oh, low dose infusion?
Yeah.
Usually Mormons, 20 mics per kilo.
So basically,
Elderly Asian women,
healthy livers.
20 mics per kilo. Never, no pain medicines, no. You know what really affects the infusion rate? Clonopin and benzodiazepines.
Really?
Patients that are on Valium-like drugs, Xanax is wreak havoc with the infusion rate. Marijuana, nothing will affect the infusion rate more than marijuana.
That's what you were telling me earlier. So you're saying with all this new medical marijuana coming out that we may see propofol tolerance increase?
We're seeing post-propofol infusion delirium. Really bad.
Who's getting delirious? The anesthesiologist or the patient?
Both. But the delirium is usually seen in, we never had it before until they legalized marijuana in Nevada.
Wow.
Never saw it once. I had to reintubate a patient because of it.
Wow.
It got out of control. Bodybuilder was on steroids, smoked like, so many joints every day, and he had a 15-minute operation. He went insane. 5 nurses, everyone's holding him down, and he wouldn't come out of it. So I intubated him. We had to send him to a hospital from the surgery center. And then the ER doctor, I called the ER doctor and checked, and the ER doctor goes, "Oh, we extubated him. He's doing great." I go, "What's the secret?" He goes, "You got to give him more propofol." So that's what he did, and then he woke him up and extubated. But the ER doctor knew all about it because he's seeing more and more patients come in from surgery centers and hospitals, whatever, you know what I mean, with problems.
Wow.
That was my first one.
And you think it was related to marijuana use?
So the ER doctor was convinced.
Huh.
I was too.
Yeah.
He
I don't.
says, I concur with your diagnosis. Because legal marijuana, the horticultural, it's all very controlled. The level of THC that's actually in the plant. Whereas in the old days, when people would buy it on the street corner, it had oregano in it, and, I don't know, peppermint, you know what I mean, cinnamon, basil, chives. I mean, it's like, your whole, it had your whole spice cabinet in it. So those, when you're smoking spices all day long, it doesn't affect the anesthesia. But if you got like 92% THC and you're smoking that all day long in your brain, then
Yeah.
you get anesthesia. It's a mess.
Yeah, I don't need another one. We're done. I'm literally final touches right here. Nutmeg. All right, we're done.
Or whatever they cut.
Right.
Lights on, please.
Let's see. The nerve is going to be right up in there. Wait, Luis, let's grab that out right there. Grab her.
Before legalization of marijuana, I never intubated a patient with dysphoria, had a behavior depressive or delirium.
Huh. And everyone thinks marijuana is so safe.
I see now that it's been legal for about a year and a half in Nevada, I see very
Luis,
little medicinal purpose.
I need to do a little more.
I see very little medicinal. Lights on, please. Thank you.
Sorry, guys. I mean, it's just big business making money.
Yeah, politics, if you can have the voter base completely stoned, they'll vote for you.
Yeah,
Right? That's right.
I agree. But people are desperate in pain. If they're told marijuana is the solution, they'll try it. All right, we're going to wrap this up. And any more questions from our audience, guys?
No current questions, Doc.
Thank you. All right. Looks good. That was a tough one. Scope off. All right, we're going to use a little antiseptic to clean out the wound. We've never had an infection with the Deuk laser disc repair. 1,400 surgeries done. Let me have the thing. He got some good sleep.
Dad, I'm enjoying the video.
Enjoying what? From what?
Let's just talk about he loved that study that we quoted. He thought that was interesting. He loves that research and stuff.
Good.
Study about the Japanese study. He loved that. He said,
Ah. How old is he?
He just turned 20.
20. All right. I'm hoping my son gets back to that. The only thing he reads is Snapchat.
You know what book he likes to read the most? It's
The Bible? That's good. A lot of good stories in the Bible.
He knows the Bible, he knows the passages.
That's good. I used to know the Bible backwards and forwards.
Did you go to a Catholic school? Or
Went to a Christian school, Lutheran.
my son went to Lutheran.
Lutheran, kind of Baptist and Lutheran. Baptist from 1st to 9th or 8th, and then 9, 10, 11, 12 was Lutheran. The Baptists were the most strict.
I really would like you to meet my son. I think you really.
I'm hoping to meet him. All right, everybody, take a look. Here's the incision for the surgery. He has one on the right, one on the left. We lost 2 milliliters of blood. Not much blood at all. So, any last questions? All right, if you have a question, type it up. I'll be happy to answer it live, face to face. I'm going to head over in a minute and I'll finish our broadcast from the broadcast room. Herniated disc at L4-5, L5S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a good diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Ari Deuk-Mason. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, And neither one of them picked up what was wrong with me, even though I had the MRI. And you came in and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain,
No,
remember?
absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, you know, a long time ago, remember when people did something great, you said, what are you going to do now? They said, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Good morning, I'm Dr. Deuk Major. I'm here with one of my patients, and you traveled to Deuk Spine Institute here in Florida from where?
New York, Poughkeepsie, New York.
Awesome. And why did you come from New York to Deuk Spine here in Florida?
Because I heard that this was the best place for me to go.
What kind of problems were you having that you needed to come here?
I had lower back problems and numbness in my leg, which was my left leg. This was the best place for me to come.
Okay. So you had back pain, sciatica down your left leg, pain shooting down the left leg.
Yes.
And that was just yesterday, right? When you
yes,
had
that's
that.
correct. Yeah.
And what, do you still have your back pain today?
No more back pain.
It's gone.
Gone.
And is that because we have you doped up on powerful painkillers?
Nope. None
No, it
whatsoever.
isn't. Did anybody in New York offer you spine surgery to fix your back?
Yep. Yes, they did.
Yeah.
And they wanted to fuse it.
Yeah. And you've had surgery before. You had a microdiscectomy, and that helped you for a little while,
Yes.
but the symptoms came back.
Came back.
Yeah. All right. Well, they're not going to come back this time. So what do we do to make your pain go away?
You fixed my back. I did arthroscopic.
That's right. Arthroscopic spine surgery called the Deuk laser disc repair. So leg pain's gone, back pain's gone.
Everything is gone.
You happy?
You did. Very happy.
You're smiling.
Yeah. I tell you.
Congratulations.
Thank you so much.
We did it all through a 7mm incision, just that big. And you can actually watch that video right here, an animation, to see what it looks like to do the Deuk laser disc repair.
A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own.
So now that your surgery's done, what are you going to do?
I'm going to go home and enjoy my life.
Good for you.
Enjoy my life.
Congratulations.
I am very happy.
Anything you want to tell your viewers?
Other than this is the place to come, it's worth the travel.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. the laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. The fiber optic laser used in the